Veterinarian Dr. Craig Pryor joins us now for some of your questions. As always, thank you for being with us today.
My pleasure.
All right, we will start with Darnell. Thank you very much, and go ahead with your question, please. Hello, Darnell. You're on the air, Darnell. Go ahead.
Yes. I rescued a little kitten a few weeks ago from the local store here. He was hanging around, and he bites. He's a very playful, very friendly kitten, but he bites. What can I do to stop him from biting?
Well, it depends what he's doing when he's biting. It's a lot of times it's play biting, and that's normal for a kitten, so it's a matter of toning it down, and you can just stop play. If it's when you're patting him, a lot of cats will bite you when they've had enough. They're trying to tell you stop. So you need to look at what perspective this is and work with him on it. You know, the biggest thing is if it's when he's playing, just stop the play and walk away. Let him know that you're just not going to get any attention from him. So that's sort of a quick answer for you. See if that will help you a little bit.
All right. We have Sarah with us right now. Sarah, thank you for watching, and go ahead, please.
Yes, I have a dog that I've had for over 10 years. He was about 2 to 3 years old when we got him out of the shelter. But I'm suspecting he's about 15 years old, and he has trouble sometimes getting up and down in his hind legs.
Right, right.
I was wondering if that was arthritis and what was the best thing to do for him.
Sounds like it certainly could be arthritis. That is the early signs. They have trouble rising. They have trouble going back downstairs, jumping, things like that. So, you know, there are many things that can be done from arthritis. Anything from, depending on how severe it is, from just diet. There's a diet out there called JD that actually helps in arthritic dogs. It's wonderful. So there's something like that, all the way through to medications that you could use. I would encourage you to take him into your regular veterinarian and have that discussion about what's going to be the best options and come up with a treatment plan on where you're going to go with this over the long term. Because there's a lot of things that can be done to help him out and make him more comfortable and give him a better quality of life.
All right. We've got Janice with us. Janice, thank you very much. And go ahead with your question, please.
Hi. Yes, I have a dog. I'm thinking she's about 15, 16 years old. I've had her since 1999. Originally, I didn't bring her up as a small puppy, but she is a dog that will not sleep when I go to sleep. It's really nice. She stays up all night walking.
Is that something new? Is that new?
No, she's done that for quite some time. I didn't know. She's like very anxious, and then when I get up, then she goes down and she sleeps all day. And I didn't know if an anti-anxiety medicine would help. It
may. There is a condition in dogs called cognitive dysfunctional syndrome. It's like doggy Alzheimer's, and a lot of times early signs we're seeing that is their routine gets switched, whereas they're sleeping when we're awake and vice versa. So it could be something like that in the early stages. There is a diet for that. There's medication for that. I think this is something that you probably should rule out some type of this or some other underlying problem going on with your dog and see if medication is going to be the best way of going. So get in contact with your regular veterinarian and get her in to see them and see what can be done.
All right, going to get one more in, and we're going to go to Rita. Rita, thank you very much for watching, and go ahead with your question, please.
Yes, I have a 2-year-old male St. Bernard, which we have not had neutered yet. And he is quite aggressive when someone comes up. Otherwise, he's not. And someone told us if we'd go ahead and have him neutered, he may calm down.
I think that would help. It may not necessarily solve all your issues, but that absolutely is the first step, is to get him neutered, and at the same time talk to your veterinarian about what to do about aggressive situations, because there is behavioral modification that you can do with him to help temper that. So yes, go ahead and follow through with that.
All right, as always, great information. Thank you for being with us today.
My pleasure.
Now, if you'd like to get in touch with Dr. Pryor, we put his contact information on our website at newschannel5.com.